diabetes is indeed fast becoming a major global healthcare concern. The World Health Organization recently announced that the global number of adults living with diabetes has quadrupled since 1980 to over 400 million in 2014. And of these 400 million, over 400,000 are in Singapore. There are Singaporeans, among Singaporeans, about 400,000 have diabetes. And 1 in 3 Singaporeans have a lifetime risk to develop diabetes, 30% lifetime risk. What is 1 in 3? When I sit in my seat, I look to my left, I look to my right. On my left, Mr. Lim Swee Say. On my right, Miss Grace Fu. I look at Mr. Lim, I asked him yesterday, do you have diabetes? He proudly declared, no. So I turned to Miss Grace Fu. I was too polite to ask her, but she doesn't look like having diabetes. Those are the good news. The bad news is 1 in 3 means I have the highest risk of having diabetes. That's 1 in 3. But the good news is we can change. We don't have to accept it, and we can reduce the risk. And of those who have diabetes, 1 in 3 Singaporeans have not been diagnosed. And among those who are diagnosed, 1 in 3 have poor control of their conditions. Somehow it seems to be 1 in 3. The following images may be graphic, but they are good examples of what some Singaporeans endure daily. Left undetected, untreated, or poorly managed, diabetes can lead to heart disease, stroke, kidney failure, blindness, and amputations. In fact, 4 Singaporeans a day lose a limb or appendage due to diabetic-related complications. These complications reduce the quality of life for the patient and increase the burden on the individual, families, and society as a whole. A Saw Swee Hock School of Public Health study estimated the total economic burden of diabetes for working-age adult at more than $1 billion a year. However, the long-term cost of diabetes, taking into account the psychosocial burden, is far more than this. We need to tackle the diabetes challenge. Therefore, I'm declaring war on diabetes. We want to help Singaporeans live life free from diabetes, and for those with the disease, to help them control their condition to prevent deterioration. This is a multi-year effort. We will engage stakeholders and develop detailed action plans together, but let me outline our broad strategy. First, we will work on upstream prevention to promote a healthy lifestyle and reduce obesity rates in order to cut down on new diabetes cases. Broadly, we are doing this by ramping up our health promotion efforts through a twin food and exercise strategy. We will improve the dietary quality in schools, communities, and workplaces, and learn from successful international regulatory strategies. To encourage more people to exercise, we'll expand ongoing programs such as the National Steps Challenge and Sundays at the Park, as well as introduce new programs and bring them to schools, workplaces, and the community. The risk of developing diabetes is 30 to 40% higher among active smokers than non-smokers, and we will be doing more to curb smoking rates as part of this plan. Healthy habits start young, and Minister of State Lam will be leading our effort in developing the Nurture SG plan to tackle many of the preventable risk factors for our youths. We'll be working very closely with the Ministry of Education to develop and implement this plan. Second, we will strengthen early screening and intervention to identify the disease early, especially those at risk. Screening plays an important role in our war by picking up cases earlier, starting interventions, and thus reducing the likelihood of the gory images I showed you previously. This is like intelligence in warfare. But follow-up after screening is equally important. We hope that earlier intervention and basic lifestyle changes can even reverse the pre-diabetes state and get such individuals back to health. In a US study published in the New England Journal of Medicine, pre-diabetes can reduce the overall incidence of diabetes by 58% through diet, exercise, and behavior modification. That's why I say we still have hope. These lifestyle changes worked particularly well for participants aged 60 and older, reducing their risk by up to 71%. So you are never too old to make lifestyle changes and take back your health. Third, we will support better disease control to slow disease progression and reduce complications. For those with diabetes, we need to do our best to help them have good quality of life at all stages by having good control over their disease. This can help to reduce or delay complications and give patients better quality of life. The key to winning the war on diabetes is for all Singaporeans to be engaged in the battle. The key partners in this war are the individuals, his family, and the community. By working together, we hope to create an environment that makes healthy choices easy. But Singaporeans also need to play their part by eating healthily, exercising often, and going for the recommended screenings and follow-ups. We can also play a part in encouraging and helping others to do so. We will be increasing public awareness about diabetes and empowering individuals to take control of their health. To coordinate the strategies on the war on diabetes, I will be co-chairing a Diabetes Prevention and Care Task Force together with Mr. Ng Chee Meng, Acting Minister for Education. The task force will include representatives from government agencies, the private sector, patient advocacy, and caregiver groups, and will develop and implement a multi-year action plan for the war on diabetes. Reach out and mobilize the nation to fight the disease together and monitor and evaluate the outcome of our efforts. The war on diabetes will not be a quick battle, but a long war requiring sustained efforts. Results of our efforts can only be seen in the long term, but we must persevere. And if we succeed in shifting mindsets and changing habits, we'll be able to curb not just diabetes, but other related chronic diseases such as heart disease as well. And we will improve the lives of Singaporeans and reduce the burden on their families.